Hey everyone, my name is Dr. Galatia Strong. I'm a physical therapist who got a 100% on my NPTE, and this led me to found SPT with me, which is an NPTE prep platform. If you enjoy what you see and you're studying for the NPTE, check out our prep courses at sptwithme.com. Now, for what you're actually here for, let's answer the question of how do you choose the right functional outcome measure for your patient? There are so many different types of functional outcome measures to choose from. If you want to know what the best one is for your patient, you also have to know what the options are. Now, first of all, there are subjective outcome measures. Typically, these are multiple choice questions. They go from a 0 to 4 scale, 0 to 5 scale, at least something similar to that. The idea is to get your patient's self-perceived perception of how they're doing, whether it be about how severe their pain is when they're performing certain tasks or how much assistance they need with certain tasks. This is not an objective finding. This is what your patient thinks about quality of life or their current state of function. Then next we have objective measures. So you as the therapist are measuring something quantifiable. You're measuring how far this patient can jump. You're counting the number of sit-to-stands that a person can perform. You're looking at the number of feet that they can walk across. You're looking at how long it takes them to walk across 10 feet, things like that. Now, between both of these, objective and subjective, you need to figure out which to choose from with a purpose. If what you're gathering, for example, is maybe that through your patient's subjective complaints, it's highly psychological. For example, they have a lot of fear when they walk. You might then choose to do a subjective outcome measure to see how much they feel it affects them. But at the same time, you might also choose to perform an objective outcome measure to show what they truly can do. So sometimes there is a pretty big difference between what a patient thinks they can do and what they say they can do versus you as a physical therapist, you're objectively finding what they are physically capable of doing. There are functional outcome measures that address endurance. So for example, the 6-minute walk test. With this test, we're trying to see how far a patient can walk within 6 minutes. This test is purely a quantitative test. So it's just how far can I walk in this 6 minutes? It is not a qualitative test. We are not assessing the quality of their gait. We're not assessing their step length. We're not assessing the way that they move, the speed. Nothing like that. It's just how many feet can this person move? Additionally, we can use a walker, we can use a cane, we don't need to use anything. But this is a great test to perform if a patient says, I need to work on endurance, I'm noticing that it's declining. There are outcome measures specific to addressing functional strength. For example, sit-to-stands. This is a functional movement. The 30-second chair stand, aka the 30-second sit-to-stand test, this is a measurement demonstrating the amount of strength that your patient has. A certain number of repetitions. If a person's 60 years old, they should be able to do a certain number of sit-to-stands and etc. with other age groups. Then we have those for balance. For example, the 4-stage balance test is a test of balance. You have your patient standing up, their feet together, put them in a semi-tandem stance, then you put them in a tandem stance, and then you see their ability to balance on one leg. Well, if they cannot do tandem stance, this might suggest that they're a fall risk. So you might choose to address someone who complains of balance, and specifically balance in standing, since this test is done in standing. So specific to balance. Outcome measures can be based on time. So it's a matter of how many repetitions can you do within this certain amount of time. For example, the 30-second chair stand. How many sit-to-stands can you do within 30 seconds? Then on the opposite side, we have a test called the 5-time sit-to-stand. This is not done within a certain time frame. But this allows you to see how long it takes your patient to stand up and down 5 times. It could take 10 seconds. It could take a whole minute. The timed up and go. You're not stopping your patient at any particular time. You're just trying to see how long it takes them to do the task. So with all these examples, you can see the difference between a constraint of time versus just how long does it take for this person to accomplish their task. For some outcome measures, you're asked to do one task just once, while with others, you're asked to do the same task over and over and over again. For example, with the Berg Balance Scale, you do 14 tasks but just once, and we assess based off their performance of each one of these. With a 5-time sit to stand, well, it says it in its name. You're having your patient sit and stand 5 times, so you're having them do the same movement over and over and over again. Then there are population-specific outcome measures. This is pretty dense. Now with these, you can divide them into groups like age group or diagnosis or activity level, functional level. Now, for example, if a person is between the age of 60 and 64 years old, their timed up and go score should be ideally within a certain range. Their 30-second chair stand score should be in a specific range. And different ranges are recommended for different age groups. Then with a diagnosis-based functional outcome measure, we have ones that are specific to people who have had a stroke. So for example, the Fugl-Meyer. The Fugl-Meyer is not meant for those who have had a TBI, a traumatic brain injury. They're not meant for those who have Guillain-Barré or they just fractured their tibia. It is very specific to those who have had a stroke. Then you're also going to have functional activity level differences. We can categorize outcome measures based on that. So regardless of age, all the patients you see can, present with a huge range of physical activity levels. There are 16-year-olds who are athletes, but there are also 90-year-olds who are athletes. 16-year-olds who have great balance and 90-year-olds who have great balance. People who have traumatic brain injuries at 16 years old. 90-year-olds can get traumatic brain injuries as well. So just depending on how your patient presents, you're going to test them based on that. So for example, STAR excursion balance test. You can use this on a young athlete who got a fracture or a surgery, and you can see if they can return to their sport or not safely. You can also use this test on a 55-year-old female who, they might have gotten a hamstring strain and they want to return to running. So it really does not matter about a patient's age at all. It is based on their activity level. So a lot that we can categorize under this. So with all these options, how do you know that you're choosing the right one for your specific patient? You can't just assume that because they're 50 years old, you've got to choose the timed up and go. Because they're a person who's had a stroke, you have to choose the Fugl-Meyer. No. So let's talk about some things to consider and help you narrow it down. So there are 3 main things that I want you to think about. The first thing is to think about functional outcome measures that you know that are for specific populations. We've talked about one already, Fugl-Meyer for stroke. You can use the HIMAT for people who have received a traumatic brain injury. It's specific for that population. If a person has ALS, there's a specific functional outcome measure for people who have ALS. So this is one way that you can narrow down which outcome measure to choose from. But keep in mind that just because a person had a TBI, the HIMAT might not be the most appropriate for them. There are so many different severities, right? It's a spectrum. A person who has had a traumatic brain injury can be in a coma. Are you going to expect this person to be able to hop on one leg? Of course not. If a person who has had a TBI, they're able to walk, but they use a walker, they definitely need to rely on that walker too. Would it still be inappropriate to implement the HIMAT? I'd say yes. So thinking about specific functional outcome measures can help you narrow it down, or population specific, right? It can help you narrow it down, but you have to realize that there's more to it than just the diagnosis to help you choose which one is the most appropriate for your patient. Another aspect to base your decision on, which outcome measure to choose from, is the functional level that your patient is at. So let's say that your patient has been in a wheelchair for years. And when I say this, I mean they are not able to ambulate at all. Are you going to make them do something super high level like the STAR excursion test? If they can't even stand up, that doesn't even make any sense to choose that. I'm probably going to choose some functional outcome measure that I know is more geared towards people who need to maybe maintain a sitting posture all day like they do. So this might be something like the function in sitting test. Now on the other hand, let's say I have a 30-year-old basketball player who is now months out from his or her ACL surgery. Well, I know they can run. I know they can walk. I know they can sit. Does that mean that I need to test how they're performing in the function and sitting test? No, I know they're going to do well on that. There's literally no reason for me to perform that test since they're going to pass it with flying colors. Now, if there's an 18-year-old who got a traumatic brain injury and they're a few months out after getting a coma and they're doing well, and you're trying to figure out what the next step is for them because they've been at this state. Let's say they've been using a front wheel walker, but you feel like they can maybe start transitioning to using a cane or maybe even nothing at all. You can maybe implement something like the Berg balance test. So remember that age has nothing to do with a majority of these tests. A 50-year-old who's had a TBI might present the exact same way physically that a 17-year-old who had a traumatic brain injury might as well. The last thing you want to consider is your patient's goal. When your patient comes to physical therapy, a big part in general of what you choose to do is based on their goal. Now, of course, you have to have realistic expectations for your patient, but let's say my patient is a 50-year-old and they've got a herniated disc, and this guy used to be an athlete, but at this point in time, when you're going throughout your subjective evaluation, he's like, honestly, I don't really care to go back to running anymore or playing a sport anymore. So in this case, for me as a physical therapist, there's no reason for me to test out higher level balance activities like the Y balance test or the Star Excursion balance test, because that's not their goal. What's the point of putting them through it if it doesn't matter to them anymore? So maybe working on something like avoiding a fall risk and things like that might be more appropriate for them. When you end up choosing an outcome measure for your patient, the way that you'll know it's the perfect one is if it proves the purpose of your use for it. If a patient is going to pass that functional outcome measure with flying colors, you've chosen a horrible one. If you're expecting your patient to absolutely fail the functional outcome measure, then you've also chosen a horrible one for them. The best functional outcome measure you can choose is one where the patient has some success in it, but some failures in it. You are using the results of this functional outcome measure to justify why they need to continue with physical therapy. Now, if we're talking about this being assessed at the next session or the last session, you're doing this functional outcome measure again, then sure, I do want them to pass it. But if you're on an initial evaluation or you're doing a progress note and trying to find something new to show that your patient needs to continue with you, then you need to be able to find one that shows both their strengths and deficits. So if your patient passes it 100%, it's going to look like we're fine. Your patient doesn't need to come in for anything since they're already good. But if your patient got a 0 out of 100 on the other hand, well, it looks like that activity might not even be appropriate for them at all. So maybe that's poor judgment on your part as the therapist on what your expectations are out of this patient. So no matter what you choose, make sure that it is the most appropriate for your patient in showing what they can realistically work on to get better at. If you enjoy learning material in this way, check out our courses at sptwithme.com when you're studying for the NPTE.